Now, let's get reaction with the South African Medical Association chairperson, Dr Mvuyisi Mzukwa. Dr Mzukwa, thank you so much for joining us on Newzroom Afrika this evening. Now, I know your association and the department has been in talks for quite some time to deal with this crisis. But what do you make of what you've just heard the Minister of Health, Dr Joe Phaahla, give reasons for some of these delays?
Program. I was listening to the media briefing by the minister during the course of the day. Minister mentioned a couple of things. One is that they are going to work with provinces to create posts, that there are a growing number of graduates over the years, and that there are budgetary constraints as well, you know, in as far as the Department of Health is concerned. But we've identified gaps in what the minister was presenting to the nation. One, we're disappointed that the minister could come all the way, invite the media, take time of South Africans, you know, to listen to the minister, thinking that he's going to come up with a plan, a plan to employ, you know, these graduates, medical graduates that are not employed. Well, these are the gaps. First of all, we've identified that there's no forward-looking plan for graduates, you know, that are produced in South Africa and abroad. You will recall that we've got a number of doctors that are being produced abroad for South Africa, like Cuba and many other areas, you know, and you would think that there is a plan in place, you know, for these doctors to be absorbed into the system when they come back. But as you have seen now, there is no plan at all whatsoever. You know, the minister gave us no plan. The other thing is that there is a fragmentation, a clear fragmentation, you know, in the Department of Health. If you look, for example, the National Department of Health versus the provinces, it looks like what the department is planning to do as the National Department of Health is not exactly the priority of the provinces, because provinces are doing their own thing and the National Department of Health is doing their own thing. So you then ask yourself, I mean, we're looking forward to the NHI, you know, like it has been promised to South Africans. How are you going to make the system ready to, you know, to accommodate the NHI, what we call the universal health coverage? You know, how are you going to achieve that if you are failing, you know, to absorb already qualified graduates in the system? And also, there is obviously a need to cut the costs, you know, in the district health system, where you find that you've got middle managers who are running around like headless chickens, attending endless meetings, and not coming up with anything tangible. They are running around with government cars, but there is no anything tangible coming out of that. But also to remind the minister that, you know, when he talks of committed overtime, it is not a benefit. He mentioned it as one of the benefits. It can't be a benefit. Committed overtime is a service need. We need it because there's a shortage on the ground, and we need more, you know, the hospitals to be covered 24/7. And I do think that, you know, regarding this, we were proposing clearly that the National Department of Health should actually be bailed out by Treasury, like they do with other state entities. Now we've got a serious problem in the Department of Health, where you find that we've got problems of litigations, because if you've got underserved communities, obviously there will be poor quality of service that is given to those communities, and that will lead to litigation. And that's what you want to avoid, you know, at all costs. So this is exactly what you are pointing out, to say, if there is a plan, it must be a plan to employ more in the Department of Health. We know, as it is now, that our colleagues are suffering from burnout because of these shortages. Some of them are attending, are receiving psychiatric services because of the, you know, what they are facing on the ground. So to come up to the nation with an empty speech like what the minister did today was a huge disappointment.
And as you mentioned, Dr. Mzukwa, from your view as an association, there is no forward-looking plan. But how did we even get here? You know, there are certain careers that are traditionally known to be prestigious and almost like a guarantee at good employment. And medicine is certainly one of those careers. But for years now, we have found ourselves in this very position where it's no longer the case. And medical doctors are sitting at home unemployed with necessary skills that are so desperately needed in our healthcare system. When and how would you say the problem started? How would you diagnose it?
Well, it started a few years back because you'll recall that, quite a long time now, we even in 2017, we've had a march here in KZN as the South African Medical Association, highlighting the shortages that are experienced by colleagues on the ground. And, part of the issues that we identified at the time was broken machinery and all those things. But when it comes to employment, it has always been difficult for the Department of Health even to employ the statutory placements like internship and community service. At times, we had to promise them we're going to drag them to the court of law if they don't place those interns and community service. And now they've got a chance now to populate the rural areas that are underserved. And they are allowing the graduates to go to the private sector and to go to other nations abroad. I mean, we've been told by the Department of Health, that the public sector is serving about 85% of the population, and the private sector is serving about 15 to 16%. Now tell me, if you cannot absorb these graduates, you tell them to go to private sector. What are you saying about the public sector? Are you neglecting your own public sector, sending these graduates to private sector and sending them to Canada and all these other places when actually they've been educated and trained by using taxpayers' money in this country to serve the underprivileged and the indigent in this country?
And the private sector that, as you mentioned, is servicing about 15% of the population. So what are we missing here? Why does it seem that the problem is getting worse? If we've known already about this, I mean, already in 2017, your association marched for this. Here we are in 2024, and the problem is not only getting better or even being arrested, it's actually worsening.
Well, what we are experiencing is leadership and governance. We are experiencing a serious challenge with a budgetary allocation. If you notice, you will have seen that our budget has been going down by at least 1% over the years, each year. The other thing is, in 2020, we had a plan called the Human Resource for Health Strategy 2030. It was developed in 2020, but that is gathering dust. There is no implementation. Instead, we are excited about the NHI and all these things, when actually our hospitals are rotten, our hospitals are dilapidating, and our hospitals have broken machinery. Hospitals don't even have CT scans. You are waiting for a silver bullet called NHI that is going to all of a sudden help all of us. It's a lie that is being touted out there by government, instead of them telling the public that they are going to fix the public sector and also make sure that they partner with the private sector so that the South African community is served by both the systems. You are not the Department of Public Health. You are a Department of Health. You are responsible for the department for both sectors, the private sector and the public sector. So it can't be that you are failing, to use these systems at your advantage so that they serve communities on the ground.
The minister as well earlier was saying that, in fact, this is not a bad thing for the NHI, basically defending it, saying that if we did have an NHI system that was properly in place already, we wouldn't find ourselves with these problems of these young graduates as well. What do you make of that?
like I said, first of all, we've been told a number of times that there is no money. Initially, the Minister of Finance, the spin doctor, has been telling us that there is no money. And then I think he was pulled aside and was told to toe the line. And then he came back, he said there's money. We are going to have to implement the NHI. Now we are told again by the Department of Health that there is no money. So how are you going to do that? Because where is that money going to come from? Because first of all, you have got a small tax base on the ground. How are you going to implement it? These are the questions that have not been answered by the Department of Health, but everyone who is now excited about this NHI.
You've also called, as the association, you've also mentioned earlier that what you think the National Health Department needs is a bailout, as we've seen government give bailouts to various SOEs as well, that they should do the same with the Department of Health, that it's reached that kind of crisis level. What are the chances of that happening?
Well, I think in government, if we're not suffering from what they call intellectual laziness, we must find a solution to this problem, because, like I said, if you can't keep your population healthy, how are you going to advance the economy of the country? Because the economy of the country is directly linked to the health of the population. So it's not like you are spending when you attend to the issues of in the Department of Health. You are actually investing so that not only you've got a healthy nation, but also you've got a population that can advance our economy. So to me, it does not make sense that we want to actually cut costs in the public health, whilst actually we are destroying the economy in the same vein. So I would urge government, to not play these games, these political games that they are playing at the moment, because we know that our patients in the rural areas, even in the urban areas, I mean, you've heard about Rahima Musa Hospital, you've heard about Tembisa, you've heard about Baragwanath hospitals, you've got hospitals in the urban areas suffering. You heard now in the Western Cape as well that there is a serious challenge because of these budgetary constraints. So we're saying to the department, if you are serious about cutting costs and even stopping the litigations, populate those vacancies in the public hospitals so that we do not lose money to the lawyers and everyone else.
And if you're looking at urban areas with hospitals that are already struggling, like in Gauteng, the examples that you've just made, then when you consider in remote and rural areas how worse the situation is there, it's quite obvious that it's not a kind situation. But some of the reasons that have been given for this low placement of young doctors has also been that some of them don't want to be placed in these remote rural areas and they prefer to be placed in urban areas.
I'm glad you are saying that some of them, not all of them, because it's just, scapegoating. Because if you look at, what the minister is saying, he's saying there are no posts in the provinces. Yet they tell us that no, your doctors don't want to go there, but there are no posts. Where are they going to go when there are no posts? There has to be a post for the doctor to go there. So I think it's just a politicking to say that young doctors don't wanna go there. They are unemployed. Why can't they go there? They are unemployed. Why would they choose to go to other countries when actually they're leaving behind families and some of them may have other plans in South Africa? Why would they leave their own fiancés? I think it doesn't make sense at all to be blaming these doctors to say they don't want to go and be placed in the. I mean, about 1,000 of them, all of them don't want to go in the rural areas. That's very unbelievable.
And also, when you do look at the state of these rural health facilities as well, can one blame some of those young doctors who feel that I don't want to put myself in that kind of environment where I don't have the resources that will enable me to properly fulfill my duties?
You know, with the rural areas, there are serious problems. You know, there's all what we call social determinants of health. For example, I always make an example of the Eastern Cape, that there are villages in the Eastern Cape, about 80%, if not more, of those don't have clean running water. So you want to go and throw doctors there, you know, and think that if you throw in a doctor there, you are going to solve the health problems of that area without solving water, without solving the nutrition there. We've heard in the Eastern Cape that many children are suffering, and you've got a government that is not willing, you know, to even attend to children, and they want to just throw a doctor there to solve all the problems there, health-related problems in the rural areas. So there are so many issues that need to be resolved in those areas. I mean, those people in the rural areas have been having no water for more than 300 years. It's not that 30 years that this government has been in place. In fact, they've been promised lies by this government to say that they are going to have water and all these things. And come election time, they make the same promise. And after that, off they go and forget about those rural areas. So, you know, we do need those social determinants of health to be attended to. Those people must be employed. Secondly, those people must have clean and running water. There must be stable electricity, you know, so that they can run their own businesses and all these things. And then you need to have shopping complexes. I mean, you expect a young doctor to go and just be in the rural area and there's no life in there. So there must be life that comes from the government itself.
Mm. I mean, at this rate, it seems no one wins, not the doctors who are sitting at home and not the patients who are in state hospitals who are demanding more doctors. I guess it's only the international community and probably the private sector that's benefiting off this crisis.
Well, I'm sure mostly it would be the international community, because to go to private, you've got to have some capital, you know, to start a private practice and stuff like that. Some of these colleagues don't have that money. In fact, most of them don't have that money. So the easier way for them might be to go out in other countries, you know, and be absorbed there. I mean, if you look at Canada, for example, they are looking for South African doctors, you know, like, I don't know. They always, you know, hunting for South African doctors. So it means we are using taxpayers' money to train for other countries when we neglect our own communities who don't have doctors to attend to. And also, if you say these doctors must go to the private sector, are they all of a sudden going to, you know, communities are going to afford these private doctors? All of a sudden they can afford them simply because the public sector cannot absorb those doctors. It does not make sense. What the minister was telling the nation makes no sense at all.
And speaking of that medical brain drain as well, do we know in terms of numbers how many of our doctors are leaving our shores for other countries such as Canada?
Well, we don't have numbers as the South African Medical Association, except that we could provide you with numbers from our own members, because we've got our own members who have left the country, not only junior doctors, but also specialists. You must recall that this government can't even employ specialists. When they finish their specialization training, they can't be absorbed in the system. They work as medical officers. So what they do, they then opt to go to private or else to go abroad. So we continue to lose skill in the country simply because our government cannot plan, and our government does not have a plan when it comes to human resource for health.
I'm interested in the future repercussion as well, because it's young doctors who are most affected at this point. What are the effects of that on our future of medicine and healthcare when we are facing young people who are also leaving in their numbers? What does our healthcare look like in the next 20 to 30 years if the doctors who are supposed to be gaining crucial experience right now aren't? And then you mentioned specialists as well. These are the very doctors who are supposed to be getting that experience to become those specialists in the next coming years in our future.
Now, it starts with the youth. I mean, I don't think that there's any matriculant who is really interested, looking at the unemployment of doctors. You talk to a school-going kid. Do you think they are interested in doing medicine anymore? So those things, I think the morale is going to be affected. But the other thing is, if you look at the future of medicine in South Africa, you are going to have a drain of specialists going out of the country, but also you are going to have junior doctors leaving the country. So the only people that you are going to have here are people who are aging, and there is no replacement for such people. So we are still going to have a serious challenge. I mean, we've been told recently that the ratio in the public sector is about 0.35 doctors per 1,000 citizens. And in the private sector, it's 1.75 doctors per 1,000 citizens. Now, and the World Health Organization recommends one doctor is to 1,000 citizens. Now, if you look at those ratios, you can actually see that we are still going to suffer more, because even the working conditions in the state, I mean, you will have seen in the media recently, social media showing the state of facilities in Gauteng, in an urban area, and how patients are being neglected because of these shortages, because of this broken machinery, because of poor security, because of even poor salaries, pathetic salaries that are given to doctors in South Africa. Doctors who have given their lives to work for this country, who have never left this country because they love the country. But, with the recent study that we've done, the salary that they're getting now can be equated to a salary that we were getting in 2014.
Sure. Thank you so much for your insights and your time. That was South African Medical Association Chairperson Dr Mvuyisi Mzukwa.